Is it still safe and pleasurable to masturbate after 60? That question echoes silently in the minds of millions of older men, yet few dare to speak it aloud. For many, the topic still feels taboo, despite how crucial it is for health, confidence, and overall well-being. But here's the truth: intimacy doesn't expire with age, it evolves. And understanding that evolution can transform not only your pleasure but your longevity, too. I'm Dr. Isabel Lopez, a urologist with over 25 years of experience in men's health after 55. And where are you watching from? Drop it in the comments, and stick around because I have a surprise for you at the end. In this video, we'll break down what science really says about masturbation after 60, from safety tips to the benefits that go far beyond the bedroom. This isn't just about sex, it's about health, vitality, and control over your own body. The aging body brings a unique set of challenges, and those changes don't stop at your joints or memory. Your sexuality transforms, too. So the habits that served you well in your 30s might not work or feel right anymore. That's not a failure, it's biology. The key is knowing how to adapt, and more importantly, how to thrive. Masturbation isn't a topic reserved for locker rooms or teenage years. For older men, it's a vital tool for maintaining hormonal balance, confidence, and emotional grounding. Yet, if done the wrong way, it can lead to discomfort or even injury. That's why trusted, clinical advice is essential, especially in this stage of life. By the end of this video, you'll learn how to navigate intimacy with wisdom and ease. We'll go step by step through safe techniques, health risks to look out for, and simple practices to make every experience both safe and satisfying. This is the knowledge most men never get, but absolutely deserve. Ready to reclaim control of your sexual health with clarity and confidence? Let's begin this journey together. Follow the channel so you never miss an insight that could improve your health one smart step at a time. As men age, the body undergoes a series of quiet yet impactful changes, especially in areas tied to sexual function. Testosterone levels begin to decline steadily after the age of 30, but after 60, the drop can become more noticeable. This hormone influences libido, muscle tone, energy levels, and even mood. With less testosterone, arousal might take longer, and erections may feel softer or less frequent. Skin also becomes thinner and less elastic with age, which means it's more sensitive to friction and less resilient under pressure. Nerve endings may respond more slowly, making intense stimulation either less effective or, at times, even uncomfortable. This shift calls for a more mindful approach to touch, one that prioritizes sensation over intensity. Psychologically, older men face new dynamics. Retirement, grief, health scares, or relationship shifts can lead to anxiety or self-doubt. Performance anxiety doesn't vanish with age. In fact, it can intensify if men compare themselves to their younger selves or feel pressure to keep up. These mental barriers can affect both desire and performance, creating a cycle of frustration. Hormones beyond testosterone also play a role. Cortisol, the stress hormone, can interfere with sexual desire and sleep, while reduced dopamine may blunt the pleasure response. Combined, these factors demand a more patient, informed approach to intimacy, one that aligns with the body's new rhythms rather than resisting them. Understanding these shifts isn't about resignation, it's about strategy. When men recognize what's changing and why, they can make smarter decisions. Instead of pushing harder, they can slow down, listen to their body, and work with it, not against it. Pleasure, in this stage of life, becomes more about finesse than force. And there's more to this transformation than meets the eye. What if, instead of seeing these changes as limitations, they were seen as invitations, opportunities to explore intimacy with more depth, intention, and control? That mindset shift opens the door to the next topic, where we'll uncover how self-pleasure can actually become one of your greatest health allies. Masturbation isn't just a physical act, it's a deeply personal form of self-care, especially for men over 60. In this stage of life, it plays a key role in maintaining both physical and emotional equilibrium. One of its most overlooked benefits: stress relief. Regular, safe self-pleasure helps lower cortisol levels, which can improve mood, boost immunity, and even enhance sleep quality. Beyond the mental benefits, there's also a strong connection between masturbation and prostate health. Gentle ejaculation may help flush out fluids that could otherwise stagnate, reducing the risk of inflammation or infection. It also promotes better circulation in the pelvic region, keeping tissues oxygenated and more responsive during arousal. Another powerful advantage is how it supports erectile function. Use it or lose it. It's not just a saying. Regular sexual stimulation, even without intercourse, helps maintain blood flow and nerve sensitivity in the penis. This can prevent the onset or worsening of erectile dysfunction, a common concern among older men. From a psychological angle, self-pleasure can rebuild sexual confidence. It offers a no-pressure environment to explore what feels good now, at this age and with this body. That freedom can translate to better intimacy with a partner and a stronger sense of control over one's sexual identity, even after major life transitions. Also worth noting is the emotional comfort masturbation can bring. For widowers, divorced men, or those in long-distance relationships, it's a safe, healthy outlet for desire and connection. It reduces feelings of loneliness and anchors a man in his own sensuality without needing to depend on external validation. As we move forward, it's important to ask, how can these benefits be maximized while minimizing risk? What techniques and tools make the experience not only safe but deeply enjoyable? That's exactly what we'll explore next: practical steps for safe and satisfying self-pleasure after 60. As the body becomes more delicate with age, safe self-pleasure requires intention and care. First, lubrication is non-negotiable. Water-based or silicone-based lubricants reduce friction and protect aging skin, which tends to be thinner and more prone to microtears. Avoiding dryness is key, not just for comfort, but for preventing irritation or minor injuries that could escalate. Next, let's talk about touch. Many older men unconsciously grip too tightly, a habit formed in younger years when sensation was more robust. Now, a gentler approach is not only safer but often more pleasurable. A relaxed grip allows nerve endings to better detect subtle sensations, turning the experience into something more sensual rather than mechanical. Time also plays a different role after 60. Rushing the process can lead to overstimulation or frustration. Slow build-up encourages natural arousal, healthier blood flow, and deeper climax. Think of it as a ritual, not a race. Give yourself permission to explore, breathe, and enjoy the moment without expectations. Positioning matters too. Lying on your back with a slight bend in the knees can reduce lower back strain and promote pelvic relaxation. Some men also find it helpful to engage their core or glutes gently during stimulation, which can enhance sensation and provide subtle muscular support. Visual or mental stimulation can help keep the brain engaged. Whether through fantasy, audio, or subtle imagery, the goal is to connect mentally and physically. This dual stimulation can reignite dormant pathways and rewire the brain-body connection in a meaningful way. Join the Members Club and leave a super like if these tips are helping already. But before you try any of them, there are a few common mistakes older men tend to make, often without realizing the harm they cause. And knowing what not to do can be just as powerful as knowing what works. Even with the best intentions, certain habits can quietly sabotage the safety and satisfaction of self-pleasure after 60. One of the most common: overstimulation. Using too much pressure or intensity can desensitize the skin and nerves over time. While it might feel effective in the moment, it risks reducing sensitivity and creating a dependency on rougher stimulation for arousal. Another critical misstep is ignoring discomfort. Many men power through mild pain, assuming it's normal or temporary. But at this age, any pain, whether it's in the genitals, lower abdomen, or pelvis, can signal an underlying issue. Disregarding these signs can lead to complications that would have been preventable with earlier care. Improper use of objects is another concern. Some men experiment with household items or novelty tools that aren't body safe. Materials not designed for genital contact can cause burns, infections, or allergic reactions. It's essential to use only medical-grade toys or simple, clean hands paired with appropriate lubricant. Neglecting hygiene is also risky. Clean hands and clean tools are essential before and after. Aging skin is more vulnerable to bacteria, so even a small cut or abrasion can escalate into an infection. Warm water, mild soap, and a clean towel should always be part of the routine. Frequency can be an issue, too, not in terms of too much, but rather not adjusting to recovery time. Unlike younger years, older bodies may need longer periods to feel re-energized. Respecting that rhythm helps prevent fatigue, soreness, or performance anxiety from unmet expectations. Finally, there's the mental trap of shame or secrecy. Internalized guilt can create psychological tension that undermines pleasure and self-acceptance. Reframing masturbation as a health practice, not a guilty habit, opens the door to a more fulfilling and stress-free experience. And when practiced mindfully, it sets the stage for better awareness of when medical help might be needed. There comes a point where self-awareness must meet medical guidance, and for men over 60, recognizing that moment is vital. Pain during or after masturbation is never normal. Whether it's a burning sensation, aching in the testicles, or discomfort in the lower abdomen, these are all red flags that shouldn't be ignored. Your body is speaking. Are you listening? Another sign is bleeding, whether from the urethra, skin irritation, or even in the semen. This can signal anything from microtears to more serious issues like prostatitis or even early signs of prostate cancer. Any unexplained spotting should prompt an immediate consultation with a urologist. Difficulty urinating after sexual stimulation is another warning. It might point to benign prostatic hyperplasia, BPH, an enlargement of the prostate that can constrict the urethra. When left untreated, BPH can interfere with sleep, sexual function, and quality of life. A quick evaluation and a personalized plan can make all the difference. A sudden drop in libido is also cause for concern. While fluctuations are normal, a dramatic or lasting loss of sexual desire might stem from hormonal imbalances, depression, or cardiovascular issues. Getting to the root of the problem ensures you not missing a deeper medical issue that affects more than just your sex life. Other conditions to watch for include Peyronie's disease, which causes painful curvature of the penis, or prostatitis, an inflammation that can trigger pelvic pain and erectile issues. These aren't rare, they are just underdiagnosed, often because men delay seeking help out of embarrassment. By building a relationship with a urologist, you gain more than treatment, you gain confidence and clarity. Preventive screenings and open conversations can turn uncertainty into empowerment. And in the next section, we'll explore natural, non-medical ways to boost not just safety, but satisfaction through simple, holistic habits. There's a subtle but powerful shift that happens when older men start to align their lifestyle with their sexual wellness. One of the most effective tools: pelvic floor exercises, commonly known as Kegels. These movements strengthen the muscles around the base of the penis, improving blood flow, erection quality, and even bladder control. Just a few minutes a day can produce noticeable results over time. Another key pillar is nutrition. Foods rich in antioxidants, omega-3s, and nitric oxide, like leafy greens, berries, fatty fish, and beets, support cardiovascular health, which directly impacts sexual performance. Hydration is just as important. A dehydrated body has slower circulation, lower stamina, and reduced sensitivity. Sleep and stress management also play a crucial role. Quality rest allows hormone levels to balance naturally, while stress reduction lowers cortisol, which otherwise suppresses testosterone. Simple habits like daily walks, stretching, or 5 minutes of deep breathing can restore mental calm and physical readiness for intimacy. Then there's mindful self-pleasure, not just technique, but presence. Slowing your breathing, paying attention to subtle shifts in sensation, and letting go of expectations can transform routine into ritual. Some men even report better orgasms simply by syncing breath with stimulation or focusing awareness away from the genitals and toward the full body. Exploring alternative erogenous zones can also open new doors. The neck, inner thighs, nipples, or lower back can offer surprising sensations when touched gently and intentionally. As nerve sensitivity shifts with age, broadening your pleasure map not only feels good, it helps keep the entire nervous system engaged and responsive. This phase of life offers a unique opportunity, the chance to experience sex not as performance, but as exploration. The more you nurture your body, the more it gives back. But before we wrap up, there's one final step, a practical summary of everything we've covered, and a few words that might just change how you think about aging forever. Join the Members Club, drop a super like, follow the channel, and leave a comment, because this is the kind of honest, practical guidance every man deserves but few actually receive. Let's recap the essentials. Be gentle, go slow, use plenty of lubrication, and, most importantly, listen to your body. These aren't just tips, they are keys to a healthier, more satisfying relationship with your own sexuality. Masturbation after 60 isn't something to be embarrassed about. It's a completely natural, even necessary, part of aging well. It supports your physical health, emotional balance, and confidence, especially during a phase of life when so much else is changing. When done mindfully, it becomes not just a habit, but a form of self-respect. We've covered the biological shifts, common pitfalls, safety practices, and natural ways to enhance the experience. But the bigger message is this: aging doesn't take away your sexuality. It just asks you to approach it with a bit more wisdom, care, and intention. And that's not a burden, that's a privilege. Open conversations like this one are long overdue. When more men understand that sexual health is part of overall wellness, we break the silence, reduce shame, and build a healthier future for everyone. Don't be afraid to talk about it. Ask questions, and seek guidance when needed. Your pleasure, your safety, and your peace of mind matter at every age. So whether you're navigating this journey solo or with a partner, know that you're not alone. There's strength in knowledge and power in action. And as promised, if you've made it this far, here's your surprise. Coming up next week, we'll dive into how to naturally improve erection quality without pills or devices. So hit that bell, follow the channel, and I'll see you in the next video.